Okay, guys, I've got discussion E for you. We're discussing behavior modification program for the aggression part of dementia. So here we go. Coping skills, I should call this too. So with that being said, here we go. Here's a deeper, more developed version of your presentation text, expanded with richer context, clearer framing, and more emotionally resonant language. It keeps your original meaning but adds depth to your presentation. And ready, polish. Okay, the title for this one is using a behavioral modification program to redirect dementia-related aggression. Okay, a reward-based alternative to chemical restraints. Core idea. A behavioral modification program uses positive reinforcement, not sedation, punishment, or control, to reduce aggression in people living with dementia. Instead, instead of relying on chemical restraints to suppress symptoms, this approach focuses on understanding why aggression occurs, responding to the person's unmet needs, and reinforcing moments of calm, cooperation, and connection. This model reflects the highest standards in dementia care, where non-pharmacological interventions are the recommended first-line response to aggression and agitation. It honors the person's dignity, preserves autonomy, and strengthens the caregiving relationship. Why move away from chemical restraints? Chemical restraints such as antipsychotics, sedatives, and mood stabilizers were historically used to manage difficult behaviors. But modern research shows they often cause more harm than benefit. Risks of chemical restraints include increased falls and fractures, worsening confusion, and cognitive decline. Sedation that reduces mobility and engagement, higher risk of stroke and cardiac events, loss of independence and personality, reduced quality of life. These medications may still be appropriate in short-term uses or short-term emergencies when someone is at immediate risk of harming themselves or others, but they should never be the default solution. Behavioral programs offer a safer, more humane alternative. They address the root cause of aggression, reduce distress rather than suppress expression, improve long-term outcomes, support emotional well-being, strengthen trust between caregivers and residents. This shift moves care from a crisis-driven model to a relationship-centered model. How a reward-based behavior program works. Identity and triggers. Aggression in dementia is almost always a form of communication. The person is not acting out, they are signaling distress. Common triggers include pain, like arthritis, dental issues, constipation, fear, confusion, or misinterpretation of the environment. Overstimulation, noise, crowding, bright lights, frustration during care tasks, anger, thirst, or fatigue, loss of control, or autonomy. Understanding the trigger transforms the behavior from a problem into a message. Define the target behavior. The program identifies specific behaviors. To reinforce these must be observable, realistic, tailored to the person's cognitive stage. Examples: remaining calm during bathing, accepting assistance with dressing, using gestures instead of hitting, staying seated during meals, participating in activities without escalation. Clear goals allow caregivers to notice and reward even small successes. 3. Reinforce positive moments immediately. Positive reinforcement is most effective when it is immediate, within seconds or minutes. Frequent, emotionally meaningful. Examples of rewards: listening to a favorite song, a warm blanket or soft sensory item, a preferred snack or drink, a walk, wheelchair ride, or time outdoors, visit from a therapy, pets, a spiritual ritual or prayer moment. a phone call or video message from family. These rewards are not bribes, they are comfort anchors that help the person feel safe and valued. 4. Use a good days reward system. This is a structured reinforcement model you envisioned. How it works. Each day with fewer or shorter aggressive episodes earns a good day point or sticker. After a set number of points, the person receives a larger reward. Example of larger rewards: a special dessert, a favorite activity or outing, a personalized comfort item, a visit from a volunteer or family member, a themed sensory experience, music, aromatherapy, tactile items. This system builds predictability, which reduces anxiety, a major driver of aggression. Five, train staff for consistency. A behavior program succeeds only when everyone participates. Staff training includes recognizing early signs of aggression, using validation and redirection, trauma-informed care principles, delivering rewards respectfully, documenting patterns and progress, maintaining consistency across shifts. Consistency builds trust, and trust reduces aggression. Monitor, review, and adjust. Dementia is progressive and behavior patterns evolve. The program must be flexible. Regular review helps caregivers update triggers, modify rewards, adjust expectations, ensure safety, celebrate progresses. This keeps the program responsive rather than rigid. Why this approach works. Aggression in dementia is not bad behavior. It is pain expressed without words, fear expressed without contexts, and confusion expressed without explanation. Loss of control expressed without choice. A reward-based system, a reward-based program reduces fear, builds emotional safety, encourages cooperation, strengthens relationships, gives caregivers tools beyond medication. It reframes care from managing behaviors to meeting needs. If you want, I can turn this into a polished slide deck, a one-page staff handout, a training script. Okay. Last page, guys. A caregiver workshop outline, a short video script for your podcast or YouTube channel. Just tell me the format you want, and I'll shape it for you. Okay, guys, that is it for tonight for shows. I will see everybody tomorrow for shows. For now, Gator Wellness, take care. And thanks for watching. Please remember that anything that I do, if you guys have anything to add, please leave it in the chat section below for me, and I will see what I can do about making it into a show or getting you answers for questions. So for now, Gator Wellness, take care, folks.